welcome to this COVID-19 Global Town Hall session from Rochester, USA. I'm Madhumita Sen, the president of BAGR, and it is my pleasure to host this forum. We have invited distinguished doctors and scientists from different parts of the globe who have answers to your looming questions. Is there an end in sight? Why are the number of COVID cases and deaths rising? Are we close to producing a vaccine? Will we get a second wave in fall? What about schools? Will my child be safe? Everything you wanted to know about the COVID-19, but was afraid to ask. So let's face the facts and fears and let us all heal together in this pandemic. My first guest is Mr. Adam Bello, the Monroe County Executive from Rochester, USA. He has made this community a better place. Mr. Bello was instrumental in constructing the award-winning Irondequoit Town Hall Library. He has ended the long-standing practice of offering illegal fee waivers, implemented electronic filing practices for civil cases, and created an efficient appointment system to cut down wait time at local DMV offices. He has led the fight to protect taxpayers, homeowners, war veterans, promoted recycling, and also racial and structural equity. He promotes safety and health in the county from this raging pandemic through his policies, actions, and infinite acts of kindness. Welcome, Mr. Bello. It is a pleasure to have you, sir.
Thank you. It's wonderful to be with you.
Mr. Bello, my first question, we would like to know about the county's response to the COVID-19 and also the phased reopenings in New York. If you could please enlighten us.
Sure. No, thank you. And thank you again for the opportunity to be with all of you here today to share thoughts on the community's response to COVID-19, which is obviously having a dramatic impact here in Rochester and Monroe County, New York State, across the country and across the world. And we have 19 towns and villages. We have a large mid-sized city in the middle of our county. We have two really great healthcare systems, two different hospital systems that can be competitors at times, but they obviously work together. We have colleges, universities. We have dozens of school districts. We have so many different groups. We have over 100 nonprofits, probably 200 nonprofits that serve people here. And what I thought our role should be is that entity that helps to bring people together, because this isn't an issue that faces us that knows any geographic boundaries. It's not going to respect any of those competitive nature of who we are. It's going to impact all of us because this is a new virus. So what we knew when we had our first case is not necessarily the same thing we know about it today, right? So it also, because of the changing nature of what you learn, it's also very important that you have that communication from your officials and that they're on the same page so that doesn't lead to confusion. I think sometimes right now, even we see on our national stage, a lot of confusion around the advice that we're getting from government leaders, even on things like masking, which I think most of us recognize is probably one of, if not the most important thing we can do to slow down that spread. You get mixed messages. Here in Monroe County, we did it differently. We all stayed on the same message. And I think because we did that, we were able to, we had an increase, we started spiking, but we were able to flatten that curve pretty early, I think. And we ended up doing really well. We did a lot better than other places across New York State. We did a lot better than other places across the country. We've sacrificed here too much over the last 3 or 4 months. Just so many people have sacrificed their life savings, their businesses, our health. We've had over 200 people in our community have lost their lives to this disease. And so you take all of that sacrifice and you don't want to undo it by working too quickly and then causing another spike here. So what the governor had put in place was a phased in opening where you essentially designated businesses based on what they thought the risk of the activity was. What's the risk of going into a retail shop versus the risk of going to a bar or restaurant? Put it into phases and then put guidelines. And what I view my role as we go through those guidelines, because those are going to be up to New York State. The governor has that authority through executive orders to set those types of conditions. What I view my job at the county is to help them, those local businesses, and help the public to be able to go through those phases safely and meet those guidelines. So what we decided to do, very quick turnaround, was offer free masks, shields, and hand sanitizers to anyone with a permit to be a beautician or a hairstylist in our county, and handed those out right away. We handed out thousands of them. And then that got those small businesses up and running and operating. We did the same thing with restaurants and bars. As soon as we knew the restaurants could open again, we offered PPE. So we offered masks that we purchased, and a lot of the PPE that we purchased through funding that we received from the federal government, so that it didn't come out of local tax dollars, but it was money that the federal government made available. And so we're going to do the same thing. And so as we go through the phases, we continue to look for ways. We advocate for our local businesses in Albany. We participate in a control room led by former Lieutenant Governor Bob Duffy. He runs our local control room that reports back to the state how we're doing here, and also helps us local elected officials disseminate information. And the next, obviously, big I don't know what to call it. The next big issue we have to deal with is going to be the schools.
Talking about schools, what, in your opinion, is the best model? Is it the hybrid model? Mm-hmm. How do you perceive that?
Right. So I think the best thing to do is to look at what's happening in the way the guidance came out for summer camps. My children attend a summer camp right now. And what they did there is they have the children coming back, but instead of having them all mixing together in very close environment, what they did was they cohorted the students or the campers, mm-hmm. so that there's only 10 children in a cohort. They have 2 counselors. In camp, the counselors wear a mask. The campers don't. And then they do it that way, and they do health screening. So when you arrive as a parent, you go to the table, the parent has to be there with the kids. We have to wear a mask. They take temperatures, they do the health screening questions, and then the kids can go to camp. And they do that so that if somebody turns up positive, they don't have to cancel the whole camp. They can just take the kids from that cohort and those counselors and then send them home. And then they can quarantine safely at home and then come back. So I think there's probably a lesson to be learned there for when schools open. So I think what you're going to see is cohorting, an element of cohorting. You're going to see a lot of masks, hand sanitizer, health screening. And then my guess is particularly with the older kids, parents should be prepared for more of a hybrid model where children are not in school every day, all day, but it'll be more of a hybrid distance learning model. And I think that's also to help, that would help with the crowding in the schools, be able to practice social distance, but also it would aid in the ability to again, like I said, cohort the students, because that's going to be very difficult to do particularly with the older kids, where they're moving between different classes and in different levels. The county is looking at ways that we can provide PPE to schools. So actually, that's something you and I should talk about because we still do have access to some supply lines and federal funding. So we can try to do that. But, this is also, an opportunity to tell parents who are watching this that even though schools are likely to open, because we're at this point, we're meeting the governor's metrics in terms of the health metrics. Now we have to get the guidelines right. If the schools do open, what's going to happen is you do have to be prepared for the eventuality that there could be someone testing positive in your kid's school or in your child's class. And that's going to require your child to be home for 2 weeks, right? It potentially could. So school's not going to be necessarily as reliable as it used to be for parents, right? You used to just know school's open every day. My child, as long as they're healthy, can go to school every day. That may not be the case. If there's a spread or an outbreak, you may have to, with no notice at all, just like when we closed schools back in March, with no notice at all, have to close them.
Right. And you must be working very closely with the New York governor, and also Dr. Michael Mendoza.
Correct. So we had the best public health commissioner here, I think, in the world. Dr. Michael Mendoza, incredible individual, very smart. And understands the value of collaboration and also just telling people the truth, right? I think, you see, there's a couple points I want to make about that. Some elected officials, and I think you see this on the national level, will try to pretend this isn't happening, right? If we test more, that means we're creating more cases, right? Or it's, that's an approach. It's wrong, right? I mean, just because you don't test for it and see it doesn't mean it's not there. It just means you're not dealing with it. We took the other approach of we need to tell people, we need to be as transparent as possible, right? As public officials, sometimes you stay away from situations where you could be criticized for something. But we didn't. A friend of mine reminded me early on in the pandemic that I didn't walk out onto the street and throw a vial of coronavirus on the floor and get everybody sick. What our job is to figure out how do we help people who are sick, and how do we help prevent people from getting sick, and how do we get everybody the information they need to know to keep themselves from getting sick. And so we went right out there. We were doing press conferences almost every day. We're doing town hall meetings, taking questions from everybody. That's the approach we took here. Dr. Mendoza, fantastic. The governor did daily press conferences, kept us in the loop. And the governor watches these numbers. I had several conversations with him through this pandemic where he would call, I don't want to get details of a private conversation, but he will call and say, Adam, I see a spike in cases of, individuals in this age group and this gender, from this time, what's going on there? And they're really looking at those numbers very carefully and trying to figure out what is happening in the community.
That is so great.
You're welcome.
And talking about that, what is the 5-minute initiative you took and you adopted for the community during the pandemic? Yep. And how did people respond to it?
Sure, thank you. And yeah, that was a really great initiative. The 5-minute is Take 5 Monroe, we called it, which was an initiative to try to encourage people to do what I just said, have empathy for each other, to reach out to somebody, just take 5 minutes every day and just reach out to somebody and say hello. Ask, how can I help you? What do you need? We did a lot of this. It's a community building, right? You go back and, it's to help people from being isolated and feeling that sense, and also to keep you from feeling this. I use examples of how people could reach out. And then we ask people to share their stories. Share, how are you reaching out to people? How are you connecting with people? And if you do that through social media and stuff, again, it brings people together. It helps everybody understand we're all going through this together. And this is one of the ways I think we did that. We were successful, is that we got the community doing this. We don't have a big debate here in Monroe County about whether or not we should wear masks. We all wear masks for the most part, right? When you're out, because we all know we're in it together and we're trying to help and get through it. I can go, I think I can still say I'm relatively young. I'm relatively healthy. I can go to the grocery store, and I do. But my parents, my in-laws, it was not a good idea for them 3 months ago to go to the grocery store. So we went grocery shopping for them. What I was encouraging people to do is, not everybody has a son-in-law or a son or a daughter or daughter-in-law to do the grocery shopping for them. So call your next door neighbor. If your next door neighbor is 65, 70, 80 years old, they're 80-year-old next door neighbor, and they don't drive, and they don't have a way to get to well, even if they do drive, they're 80 years old. They should not have been in the grocery store 3 months ago, even with a mask here. Ask them if you can get them something and drop it off on their doorway, right? That was all part of that community building approach that we had.
That is so meaningful. It really touches our hearts when you say these things. I mean, I wish we could spread love.
I know.
Take away the suffering, right?
That's right.
Also, your philanthropic work, which you did talk about it. Talk about the food banks, and I was reading that you've done a lot of work. And would you continue to do that?
Absolutely, yeah. I mean, that was part of the other piece of the response I didn't talk about, was bringing the nonprofit sector together in the community response there. And it was really through a lot of food donations. We were able to rally donations. And rally the nonprofit community, but also my hat's off to United Way. Jamie Saunders, who runs the United Way of Greater Rochester here, the team over at FoodLink is really just doing amazing work. And what they did was we worked with them, and they really stepped up though and created food distribution sites around the county. And then we even did try to do creative things by, when we received masks through the county, we put a box of masks in all of the food boxes that are being distributed, because if you're reaching people who are in need, the chances are they're going to need masks too, and they don't have access to that. So we would put masks in the box.
Right. Mr. Bello, it has been a pleasure having you here, talking to you. You have so much to give, so much to offer. Your work is exemplary.
Thank you. The pleasure really is all mine to be with all of you. And thank you all for, the work that you're doing to keep us all here safe and healthy, and for participating in this. This is really important. This information, and I know what you're going to discuss later on the program tonight too. This is incredibly important information. We have to be on the same page, and this is how we'll get through it. It's by
Thank
talking.
you very much, sir. It has been an honor and privilege to hear you, to have you share your ideas. And I really hope you attend our session another time. If we do something else, maybe something cultural.
Sure, I would love that. That would be great. Thank you.
All right, so we are actually going to move on to the global session with our doctors. And Dr. Iqbal Biswas was supposed to come, but unfortunately could not come because of a death in his family. And our hearts are with him, and we wish him all the best, and we pray for his family and loved ones. So our first guest is Dr. Arunava Ray, who comes to us from Amarillo, Texas, USA. He's a practicing cardiologist at Baptist St. Anthony Hospital and Northwestern Texas Hospital. He's an assistant professor at Texas Tech University Health Sciences. He's an invasive cardiologist at Amarillo Heart Group. His research includes clinical nuclear intensive care, echocardiography, and cardiac rhythm disorders. He has participated in many multi-center cardiovascular trials since his fellowship training from Cornell, New York. He is a very, very well-reputed doctor, has traveled different parts of the world, and he is absolutely brilliant. Dr. Ray, it is a pleasure for me to welcome you here tonight.
Thanks for having me, Meeta. Thank you.
And my first question to you, Dr. Ray, why are the numbers rising in Texas and other southern states? What advice do you have to prevent the spread and stay safe?
First and foremost, thanks for having me again. Southern states, I can talk mainly for Texas, they opened up a little sooner than the rest of the nation. And it opened up around the first week of May, and it was in a phased manner. And immediately after that, we saw a small spike in cases. And subsequent to that, there was this ambiguous advice about using face masks, which some people say the governor's advice was to wear face masks if you wanted to, and this was not really followed by the general population. Subsequent to that, there were 2 national holidays, so they were able to get the cases to a certain number, and it was pretty steady, and the hospital admission rate was controlled for the first few days. And subsequent to these 2 national holidays, one was Memorial Day and then the 4th of July, Independence Day, and because of the social interaction, the number of cases has increased significantly. So the hospital admission rate has also gone up, and immediately following that, the governor's advice was to use face masks and practice social distancing. Just to let you know that the virus is a respiratory virus, and you can only control it by preventing spread of respiratory secretions. So you have to use a face mask if you're just using common sense, and also use hand washing and reducing interaction between different members of society by practicing social distancing, using masks, and keeping your hands clean and cleaning them regularly will definitely prevent this rapid rate in cases that we are seeing right now. So my advice is definitely to avoid social interaction as far as coming together in very large groups. Secondly, use a face mask. And thirdly, please, please, please wash your hands and stay away from people hugging, handshaking. Have become extremely dangerous at this time. So that's my advice, is keep yourself socially distanced, keep your hands clean, and please wear a face mask.
Thank you, Dr. Ray. My next question. What treatment are you using with corona patients who have heart conditions, and how do weakened lungs affect the heart?
That's a wonderful question, Meeta. As far as heart patients are concerned, heart, we can look at it from three angles. One, where there is a blockage in the heart arteries where patients get a heart attack. Secondly, when the virus affects the heart muscle and makes the heart weak, and patients have congestive heart failure. And thirdly, they can affect the rhythm of the heart and cause some rhythm problems where patients can have severe problems. As far as affecting the blood vessels are concerned, patients will continue to have heart attacks, and the coronavirus actually causes direct inflammation of the blood vessels directly. So patients who are supposed to have heart attacks will continue to have heart attacks, and even more because there is direct effect of inflammation of the heart blood vessels, which cause plaque rupture and blockage of the heart arteries, causing muscle damage to the heart. There may be partial blockage of these blood vessels, which causes significant damage to the heart muscle. That is for heart vessel blockages. As far as affection of the muscle of the heart, it can be directly to the heart muscle. It can also affect, the virus can directly affect the covering of the heart. So what we see is myopericarditis, which basically can cause the heart to get very, very weak. And this has been shown in various studies everywhere. And the third way is to affect the rhythm cells of the heart, and it can cause problems with conduction of heart signals to the heart muscle. So patients can have severe fast heart rate, or they can have their heart not having adequate heart rate, or they can have blockages in the conduction system, which can cause severe heart problems. So how do weakened lungs affect the heart? Weakened lungs cause severe load on all three aspects that I have mentioned. They increase the heart rate, which cannot possibly happen if the viruses have affected the conduction system. The heart rate can be very, very fast, which can damage an already blocked artery and cause further damage in the heart muscle. And if the heart muscle is already very weak, it can affect the heart performance, and it gets harder for the lungs to recover because there's not enough blood supply because the heart muscle is already damaged.
Wow, that's fascinating, Dr. Ray. Is there a connection between obesity and COVID-19?
Oh, absolutely. This is a wonderful question. There was a recent article in the New England Journal of Medicine that came out on the 15th of July, which said that obesity is a state of chronic inflammation. That was fascinating because fat cells express angiotensin converting enzyme 2. These receptors are in high preponderance in fat cells. And as we all know in popular literature, that these ACE molecules are the ones that the COVID virus likes to use to enter into the cell. So whenever there is chronic inflammation in obesity patients, because of there's a state of chronic inflammation in patients with obesity, they are expressed in very high numbers on these fat cells. And people who are obese have higher number of fat cells, and these fat cells are the storage for COVID virus, which get sent to all over the body. And the second most important thing to know is that this hyperimmune response that occurs after day 8 in patients who have severe obesity and who have the severe inflammatory response, this is more preponderant in people who are morbidly obese. And obesity, along with high blood pressure, diabetes, and heart disease, these are the commonest risk factors for patients who do very poorly when they get very sick with COVID virus.
Thank you so much, Dr. Ray, but please don't leave us because we need you for the live session. I mean, these were
Sure.
brilliant, brilliant answers, and we have learned so much.
Thank you very much for having me.
It's a pleasure, but stick around, Kokoda.
Sure.
The next guest is Dr. Momita Sarkar. She comes from Virginia, USA. She is the assistant professor at Eastern Virginia Medical School. She teaches infectious disease, and she works with HIV and transplant patients with COVID-19. She completed internal medical residency at Jamaica Hospital Medical Center at Queens, New York City, then did her fellowship in infectious diseases from University of Rochester Medical Center, New York. She's board certified in both internal medicine and infectious diseases. Dr. Sarkar, it is such an honor and pleasure to have you. My first question to you is, what challenges do you face with COVID-19 patients with complications?
First of all, I would really like to appreciate BAGR leadership for hosting such an important event in this current crisis with this pandemic, and definitely thank you all for having me here. Now, the question is really great. So I would start put that way that since in the beginning of pandemic till now, we face so many challenges so far that what I could say, like, first of all, very initially when this virus evolved, this is a novel coronavirus, completely different animal. I would put that way, zoonotic animal coming from like bats or other, not from the humans to begin with. But we have seen previously that coronavirus can cause diseases, but those are mild disease and mostly affect the kids, cause regular normal colds. But this is a virus with a spectacular infectiousness and causing a lot of trouble to whoever gets it, most of the people. And next challenges, what I faced that when people started to admit it to hospital, then came to like what to treat them with. Initially, because this is a new thing, so we started to see patients and we started to learn from those patients. And so what to treat with initially, people like from our colleagues from different places, they maybe started treating with them some different medication. Let's put like hydroxychloroquine, which me and my partners, none of us were very much interested using to begin with, because there is no proven effective role for them. And this is not antiviral to begin with. So we are not interested in using this. And multiple times we have been asked by patients, family, or other providers from those patients' team that why we are not giving those. Next challenge, I should put that way, that when with the surges come, like COVID surges, a lot of patients are coming to the hospitals and still keep coming. A lot of time I really faced or like feel like, do we have enough capacity to accommodate them? And what about the PPE status in our hospital? Right. So far, our hospital doing great. I would put that way. Rooming those patients and providing PPEs, but still it's an ongoing challenge. I would put that way. And lastly, another challenge I would really like to add is that one, that as asymptomatic shader stay or us, so I always think, am I taking those to home and giving it to my family members?
So that was my next question. That is, you're a mother with 2 kids, you have a baby. What advice do you have for frontline moms and dads that have little ones? How can everyone be safe?
Yeah, this is a great question. It's very interesting. So, infection control status or processing in every hospital is quite same. All the healthcare workers so far they know that what are the personal protective equipments they should use before they meet any patients who has COVID-19. Also, especially emergency physician, they are meeting most of the patients, whoever coming to them, with full PPE because we don't want our healthcare, any one of our in the hospital to get sick without knowing anything. So this is a generalized infection control measure for everybody in the hospital. So now that you have to definitely maintain, especially I would tell you that everybody should have their face mask on all the time. This is universal masking. So no matter what, if you are in public place or if you are outside of your house, I would put that way. You should and you must wear face mask. This is protecting for everybody. And if you have any kids at home, and not only kids, I also have my parents with me, and both of them are above 65. So I have ongoing, always I think about all of them, my kids, my parents. So you have to be very vigilant about your symptoms, be compliant with your PPEs, and if you feel anytime you're having fever, cough, anything like that, just cover your face first, and then if you can isolate yourself from the family members. This all should work.
My last question to you. Do you see an end in sight?
I don't think so because, it's keep coming. This is a respiratory virus, as Dr. Ray was saying. This is a respiratory virus. A lot of things we can do from our side, but I don't think all of us are pretty compliant with all those stuff, especially mask or your risk is, it depends on where you are, how many people surrounding to you, and how distant they are from you. So if you really know that you can be compliant, very much compliant with your masking, your hand washing techniques, and also if you can avoid some social gatherings, especially indoor gatherings, then definitely you can control and you can control the spread. And as part of the community, I think you should do it because it's everybody suffering at this moment, and everybody has to be helpful to each other.
Thank you so much, Dr. Sarkar. It was a pleasure talking to you. It was so enlightening, and we appreciate you coming, but don't go because we have the live session and we need your feedback, right? So we need to move on now to Dr. Taposh Chottoraj, who joins us from Kolkata, India. He's a pharmacologist and consulting physician at different hospitals in Kolkata, India. Dr. Chottoraj has taught pharmacology at different medical colleges in India. He was a visiting faculty at NIOH dealing with orthopedically handicapped students like kids. His research work includes human plasma, organ toxicity, cardiovascular studies, and neurosciences. He has been involved in educational programs in diabetic patients in collaboration with Sweden and other countries. He's well traveled, he's very distinguished, and Dr. Chottoraj, what an honor to have you, sir.
Okay, thank you.
My first question to you. What is the most effective medication for COVID-19 patients? Do you combine several medications depending on the severity of the situation?
To answer to this question is this, till yet, we are yet to get the best medicine to treat the pandemic disease, this coronavirus. So far and so on, we have achieved a number of drugs. Not a single drug is effective against this virus. Okay, we are in the trial of getting a number of drugs. So in a single way to answer is there is no single most medicine yet available to treat this coronavirus. Okay, and the next portion of this question is, yes, certainly at this phase of trial, we are in the phase of multi-drug trial or the polypharmacy. So we can have a trial on the basis of availability of data, the patient response. So we are in the path of getting number of drugs and therapies, like the antiviral drug, like specific therapies, which will boost the immunity or immune status of the patient so that patient can combat the disease symptoms, manifestations. There are other supportive therapies. So to my opinion, it can be divided into two. What sort of medications or the treatment we should give? One from the outdoor aspects, that those are patients who are not being treated in the indoor, need only the outdoor treatment, and those patients who will be needing the indoor management, that is inpatient management. So for outdoor patients having the mild symptoms like the fever, cough, irritation, and not having the severe manifestations or moderate manifestation, we can keep those patients in the outdoor, give some medicines, symptomatic medicines. Like say for fever, we can give the paracetamol, or for the cough, we can give the cough syrup or the cough suppressions if it is dry. And for any other symptoms like say irritations, we can give some antihistamine like tablets. So these are the mode of treatment here for the outdoor patients. Next, for the indoor patients, definitely when a patient comes for the admissions, he or she is definitely moderate to severe symptoms, having respiratory distress. So accordingly, one has to give the treatment either in the specific isolation or in the ICU care. So you need a specific protocol to treat. So accordingly, presently available so much data, there are a lot of drugs under trial. Say I can tell you, number one is the most important is the antiviral drug, that is the remdesivir, is the most trial that we have been getting. So in different countries, these drugs are coming first. Next, the patients who have already infected, from there we get the plasma with the supposition that they have the adequate antibody to combat that disease. So supplement of plasma, those who are already infected, is the mode of therapy next. Then there are a number of other therapies like the corticosteroids, the steroids, the dexamethasone. Of course, I'm not going to the details of the dose and duration, the side effects of these drugs. Definitely, the other drugs are like the monoclonal antibodies. Monoclonal antibodies are the substance which helps in immunomodulations, which helps in immunosuppressions, so that the inflammatory reactions that happens due to coronavirus in the patients, they arrest these inflammations. Immunomodulators, they are specific in actions, like the itolizumab, the new drug. There are other monoclonal antibodies under trial, and they're having the promising results. So next are from the indoor aspects, you get number of medicines according to the symptoms. If the patient is on the respiratory distress or cough, we can give the nebulization with some bronchodilator, which will help the respiratory distress. Then the patient's oxygen level comes down, or he is in a serious state, we can proceed for further intervention like the ventilator and others. So these are the mode of treatment available at present to manage a patient with infection of COVID-19. Okay.
Thank you. That was very thoroughly said.
Okay.
What are your views on Moderna's quest in vaccine research? And can you tell us how much time it actually takes to create a vaccine?
Oh, it's very another interesting questions are now coming. Yes, there are 150 vaccines under trial for this coronavirus. Only 13 to 16 virus are in the terminal stage of the trial. I mean, the phase 3 trial. You know, the trial of the vaccine during production of its vaccine, there are different trial phases, like the preclinical, that's on the animals. This animal study shows the safety of this drug, basically, I mean, the vaccines. Okay. The clinical study has their four phases: phase 1, 2, 3, and phase 4. Phase 1, 2, of course, contains a small number of populations to study. Say some volunteers, 10 to 100 in the phase 1, 100 to thousands in the phase 2. And phase 3 is the most time taking trial. It takes thousands and thousands of persons to get this vaccinated and get their results. What happens about these vaccines in these trials, that a definite time is there. That's why people are interested when the vaccine will come. Actually, the scientific data, scientific regulation says that a vaccine has to come, minimum time is required is 1 to 1.5 years. In the phase 1 and 2, it can be harnessed 1.5 months. But phase 3 needs this thousands of thousand population study. Naturally, it will take time. So for Moderna vaccine, so far till date, I have got the information that they have by the 14th July, they have completed their phase 1 trial, phase 2 trial. By 27th July, they will start the phase 3 trial, that is thousands of thousand population. And this phase 3 trial is very, very vital For phase 1 and phase 2, it is the safety and efficacy. And phase 3 is not only the safety efficacy, but also the dose scheduling, in which dose one has to give to get the proper immunity, the proper antibody, which will combat the disease. Okay, so this phase 3 trial takes usually more than 8 to 9 months. But for the crisis period, it has been cut short. They hope to launch the phase 3 trial, and produce it to the governing body or the regulatory body for permission by the end of this year or early of the coming 2021. That is the best hope of Moderna vaccine. It is, of course, the mRNA vaccines. mRNA vaccines is messenger RNA vaccines. They are under trial. Okay.
Thank you so much for enlightening us, Dr. Chattaraj. It has been a pleasure talking to you and hearing your views. And now let us move on to our next guest.
Thank
He
you.
is
Thank you.
Dr. Sure. He is Dr. Utshab Das. She comes from Kolkata also, India. He is doing research on pathogens at Calcutta National Medical College. He is working on colon cancer and its immunohistochemical markers. He has practiced at Divine Nursing Home, MR Bangur Hospital, and Desun Hospital. He has been interacting with COVID-19 patients since June, but here we go. Not only is Dr. Das brilliant and dedicated and great at his art, he's extremely talented. Like his mother, Kakuli Das, Dr. Das is a very well known Tagore exponent in West Bengal and in India, in several parts. He frequently performs on national TV and AIR and in major festivals in India. Dr. Das, it is a pleasure and honor to have you here tonight. My first question to you is, how did the COVID-19 situation worsen with Amphan, and how did the government respond?
Yeah, that's a very interesting question. Actually, what you see that during any kind of natural disasters, there is lot of gathering. So the normal things of social distancing and these things were in mind of people before Amphan, but during and after the Amphan, the crisis was so much. So many trees got uprooted, so many rooftops got broken, so people almost in everywhere people forgot about the social distancing. So and also the more important thing is whenever there is after the emergency crisis management, so there is many people need to come together to manage the crisis. So automatically the many people got infected during the time, like the electrician workers who came to restore the powers. So they have to come together, many people together to work. You cannot work singly like in those cases. So many of them got infected, and many politicians who came into the relief camps, they also got infected. So this way, I would say Amphan was like a double blow in West Bengal, when it was already facing the crisis of COVID. But government, I would say, tried its best to overcome the situation. And it was not very easy manage the two things together, but they have tried their best. They have tried to give the rations or the relief materials uh, within the norms of the COVID-19. And they have also tried to increase the number of beds and increase the number of shelter homes where people can stay. So they have tried according to their measures, whatever was possible. But it is true that post Amphan, I would say the number of cases rise significantly due to the loss of the normal rules that people were following before Amphan.
Great answer, Dr. Das. And my next question is,
Yeah.
how many strains of the corona do we know of? Is one even deadlier than the others? And is there a mutation going on as we speak?
Yes, it's very interesting topic, and you can see as it is called a novel coronavirus. So we know very little about it, and there is very much debate going on. So coronavirus is a family itself. So it has four groups and seven subgroups. One of them is SARS-CoV-2, which causes this COVID-19. The immediate precursor was SARS-CoV-1, which was causing SARS. You know, so these are the seven strains, seven subfamilies of coronavirus. But within the SARS-CoV-2 itself, now there are many strains that are coming out in the trials or in the during the research processes. Even yesterday, I saw an article that the UK scientists have claimed of having six different strains of coronavirus. So when we are talking about the how the patients respond to coronavirus, these things comes very important because in some strains are more deadlier than the others. So when you are affected with a strain that is more virulent than others, so the chance of mortality goes very high. So there is very this is very important question, I would say, and I would thank you for asking this because people need to go further in their research to see these things clearly. So far, there is a mixed response, and very different scientists and different countries are saying different things. But as far as I know, that there are at least 5 6 strains right now available. But the mutations is a very dangerous thing that is very unpredictable. We cannot say. In most cases, we have seen any this kind of similar viral diseases. With time, the viruses get mutated and their pathogenesis decrease. With time, they become much less deadlier. But it is not a 100% rule. Sometimes one of the few mutations may do the opposite trick, and suddenly it becomes more virulent. So it is a very unpredictable part, and we are everyone working on it right now.
That was fascinating, Dr. Das. Thank you so much. My next question. Can you briefly give us an idea of how the third world countries are dealing with keeping safe during this pandemic?
Yeah, that is a very pertinent question. Very pertinent question, and on the humanitarian ground also. I would say, in particularly to countries which are developing, like India, there are many problems we already face that makes us more vulnerable to this kind of infections. Like in India, there is malnutrition. Malnutrition is a very big problem here. So when you are in malnutrition, so you are already immunocompromised, and there is a overcrowding. People live in very short spaces. Many people live together in short places. That also makes ourselves more vulnerable to the infections because maintaining the social distancing is not a reality in many parts of India. And and during the treatment phase that I was telling, when I was in the COVID ward, what I have seen is many people actually come very late for treatment. They try to avoid the trauma. There is the stigma attached to the COVID infection in many parts of India. So they try to avoid hospitalization as much as possible. And when the patient gets really worse, then they start to then they come to hospital. But unfortunately, that by that time it's too late. So that is a very big problem. Another point I would like to highlight is misconception. There is many misconceptions among various communities staying in India. So we have faced a very big problem initially when the health workers went to the homes of people for taking the swab samples. They were attacked. That was very sad thing. But it was out of misconception that they are targeted. So this kind of misconception we had to fight in the initial stages. And another thing I would say is there is lack of knowledge and lack of compliance among people. I still now, even now, when we are having thousands of cases per day, I can see many people while going to hospital that many people are just roaming around without masks, and they are not following the rules. And the very strange thing is these rules are for saving themselves, but still they do not follow it. So these are the main problems with the third world countries. There is lack of knowledge, and therefore, when you don't have knowledge, there will be obviously lack of compliance as well.
Bless your heart for what you do so selflessly each day and every day. This is unbelievable, the work you do. Can we please request you to sing a few lines? Or maybe a whole song of a D.L. Roy
Oh,
or
sure. Why not?
Rajnikanta or
Why
even
not?
Tagore?
Why not?
I
Why not?
mean,
A Tagore song, okay. I think at this moment a song that gives us positive vibes would do the best. I know.
Yes, thank you.
Okay, I will sing something like that. Uh, আমার মুক্তি আলোয় আলোয় এই আকাশে আমার মুক্তি আলোয় আলোয় আমার মুক্তি ধুলায় ধুলায় ঘাসে ঘাসে এই আকাশে আমার মুক্তি আলোয় আলোয় আমার মুক্তি সর্বজনের মনের মাঝে দুঃখ বিপদ তুচ্ছ করা কঠিন কাজে বিশ্বধাতার যোগ্যশালা আত্মহোমে বনহি জালা আমার মুক্তি আলোয় আলোয় আমার মুক্তি ধুলায় ধুলায় ঘাসে ঘাসে এই আকাশে আমার মুক্তি আলোয় আলোয়
মনটা সত্যি ভরে গেল, প্রাণটা ভরে গেল। Can people like at least react, show a thumbs up or something? I mean, সত্যি, this was like amazing. এত
This is
সুন্দর,
a very, very positive song. Very positive song
Yes.
of which celebrates life.
and I have no words to express our gratitude.
And I
Thank
also
you so much.
And I also thank you for arranging this wonderful event. And it was very needed and very timely done so.
But don't leave, Ucha.
No, I am with you. I
You
am
better
with you.
be staying here.
Definitely.
Yep, you
Definitely.
gotta stay for the live session, right?
Yeah,
Yes.
sure.
And now let's move on to our next guest. Dr. Prativadi is Shraddha Prativadi is an integrative holistic physician who is a triple board certified doctor. OBGYN, women's health, integrative health and medicine are her fortes, and also integrative holistic medicine. She is also certified in hypnotherapy, Reiki, and Ayurveda, and currently collaborating on an integrative Ayurveda textbook through Oxford University Press. She is founder and owner of Amory Medicine PC, an integrative healing and functional medicine practice. She is a multi best-selling author and creator of the popular online course, The V Academy. She's also the communications director at ICC, a brilliant woman, fun-loving, full of spirit and enthusiasm. And what a pleasure to have you, Shraddha Prativadi. It is an honor. Thank you.
Madhumita and everyone, thank you so much for allowing me to be here with all of you. It's such an honor and so timely and so important.
So, Shraddha, tell us about the incredible work that you are doing. Enlighten us about Amory Medicine, about the V Academy, about the book that you're writing. Tell us.
My practice actually has incorporated, a lot that has come from our culture, Ayurveda, meditation, psychoneuroimmunology, which is basically body, mind, spirit medicine. And so over the years, my practice has taken on more of a functional medicine approach. So functional medicine, I kind of call it American Ayurveda, because it looks at a person in the whole spectrum of not only their physiology and their biochemistry and all the sciencey stuff that I love, we all love so much, but it also looks at things like the science of connection, the scientific aspects of spirituality, how do relationships and love come into the picture? How does artistic expression actually affect our physiology and our immunology? I'm a surgeon as well. So my job as a surgeon and an allopathic doctor is, we kind of go in and we target things, and we're very targeted. But my approach as a functional medicine doctor and an Ayurveda is a little bit different. It's more like if you have like a knotted ball of yarn, you don't just kind of like pull one string of the yarn and expect the whole, the knottedness to come about. So the finesse that we use at functional medicine and Ayurveda is different. It's actually more like, you're unraveling that knot of yarn so that physiology can be like a nice clean line and functioning properly. So that's, that's overall what my work is involved with. And I wanted to share I got it down to 4 slides, Madhumita.
Sure,
some critical concepts. Yeah, some critical concepts that I thought, and it brings together the concepts that, you mentioned with Adam Bellows, spreading love and compassion, combining that with what Dr. Ray mentioned with inflammation, what Dr. Sarkar, talked about with transplantation and immunosuppression, and then also what Dr. Chaturaj mentioned about this idea of pharmacotherapy and symptom management. How do all of those come together? Because they seem like, wow, like all these like different parts of a larger puzzle. And so I wanted to just explore a little bit this concept of inflammation so that we understand why people with pre-existing conditions have a tendency to get much sicker with illnesses like COVID. And it's not just COVID that does this, right? So why people with chronic inflammatory conditions get sicker. And then also how COVID, as our populations are recovering, just getting over the COVID is not enough. There's a whole spectrum of conditions and there's a whole spectrum of situations that we're going to have to really step up to the plate to address. So I just wanted to share this with you guys. So these are just some considerations for us to keep in mind about managing our own individual health before and after illnesses like COVID, and why addressing immune dysregulation in regular and preventive healthcare is needed more than ever, both for our patients who have never gotten COVID and our patients who have had COVID. And the problem is that we have an epidemic of chronic inflammation and inflammatory disease. And Dr. Ray pointed to this with the cardiovascular patients and the cardiac inflammation and cardioinflammation. In 2012, 117 million Americans had chronic disease. That's about a third of the population, 50% of adults. And it's increasing at the rate of 0.5% to 1% a year. And I wish this was only America. It's actually true globally that the burden of chronic inflammatory disease is increasing. So by 2025, chronic disease will afflict over 164 million Americans, and chronic conditions account for, almost 90% of healthcare spending in the US. And what are chronic inflammatory conditions? Hypertension, diabetes, asthma, HIV, chronic heart disease, chronic liver disease, chronic lung disease, chronic kidney disease, blood problems, blood dyscrasias, and of course issues, with people on immunosuppressive medications. And of course, Dr. Ray mentioned obesity. It's a hugely inflammatory condition. And COVID-19 will make all of this worse. So are we completely helpless? Well, no, if we understand how inflammation works and if we understand the interconnectedness of all these things. So I just want to present a couple graphics for your consideration very quickly. So in an ideal inflammatory response, we have an infection or damage to tissue, that's the yellow, and we have an appropriate inflammatory response, meaning the appropriate immune cells come into the area of damage or the primary site of infection, and the infection's taken care of, the pathogen is gotten rid of, and there's no residual tissue damage to our bodies, no scarring, fibrosis, things like that. Okay, so this is ideal, and this is ideally what happens. Now, when we start to get into chronic inflammation and all of this messaging starts to go off, and our, I'm a dancer, so, our choreography starts to go off. And so in one situation, the infection does get taken care of in the yellow, but we have such an exaggerated inflammatory response that we end up having long-term tissue damage, and we end up not being able to calm that inflammatory response down. So this is one type of immune dysregulation. Another situation of immune dysregulation is where you have the continued infection and you have the continued inflammation as well of the tissue. And this can lead to all sorts of physiologic malfunctioning of the body. And actually, all these different chronic inflammatory conditions are different combinations and permutations of these types of activities. So persistent inflammation leads to chronic inflammation and disease, and makes us more susceptible when we get challenges like the COVID-19 is a huge challenge. Now, so I have come to this understanding from women's health and from all the gynecologic conditions I've taken care of in my career. But this is actually the best visual graphic I have ever seen of the interconnectedness of inflammation and stress chemistry and infections and hollow organ immunology. So just bear with me a little bit, because I think this will help us understand the scale of what we're dealing with, and why, while we have great science and we can come up with pharmacotherapy, and we have great surgeons and surgical approaches as well, we need to also look at things from a functional medicine standpoint, and even use the strength of our things from our own culture, like Ayurveda, which has thousands of years of a functional medicine type of knowledge that actually we're underusing. So when we get an infection like COVID, it exacerbates inflammation. And if you look at these 5 red bubbles, all of these things co-activate each other, meaning they all make each other worse. So inflammation makes stress worse. Stress chemistry, being stressed, makes inflammation worse. When inflammation gets worse, autoimmunity gets worse. When inflammation gets worse, brain inflammation gets worse. What are symptoms of brain inflammation? Depression, mood swings, cognitive decline, MS, and also fatigue as well. And then dysbiosis has to do with having an imbalance or the improper combinations and populations of the bacteria and the microorganisms in and on our body. And as you guys may have come across this word called the microbiome, which is basically, we're born 99% human DNA. We actually die 99% non-human DNA. And that's because of our interaction with our microbiome. So you can see how an event like COVID can really drive all of this dysregulation. And then when you go into, these blue bubbles here, which we're talking about innate immunity, which is really the immunity at the surfaces where our body interacts with the external environment. So it affects, certain aspects of our immune system, the Th1 status, the Th2 status, and then this impacts our hollow organs. Now, the COVID-19 virus, it's a virus of a hollow organ, the lungs. But you'll also notice that people who have COVID-19 are also noted to have exacerbation of kidney disease, exacerbation of cardiovascular disease. Why is this? Well, the reason for this is that our hollow organs, our organs that are hollow, our lungs, our urologic system in women, the uterovaginal system, the cardiovascular system, the GI system, all of these are actually not separate systems, but they're one system, and they're the hollow organ system. They all talk to each other. Events that happen in one actually communicate with another. I have seen this for years and years and years in gynecology. What I see happening in the vagina and the uterus absolutely is getting messaging from the GI tract and other hollow organs. So you can see why this is such like an interconnected web of activity going on. And while we're doing research in different parts of this web, before people get this and after people get this, it's really important that we work with them in deep ways to untangle their inflammation, untangle their chronic inflammation. And once people get COVID, we have to pay attention to how chronic inflammation is showing up in this, I call biology as a network of networks. We really have to think about it in terms of that. So it's good to have silver bullets, but we got to think about our network of networks as well.
Wow. I mean, that's amazing. The work you do, you are obviously transforming health and lives. And this is such a positive thing. And now for our next session, it's a live session with our fabulous moderators, Rohan Kaur and BC Kormakar. Thank you so much. The stage is all yours. They have worked really hard with the Slido questions. It's amazing. And over to them now.
Thank you, Madhumita. Good evening and good morning to our global panel members. First of all, I'd like to take this opportunity to thank each one of you for the tremendous work that you are doing to keep us safe. Thank you so much, all of you doctors. Next, as Madhumita said about the Slido, I would want to just give a quick context. In preparation for this town hall, we had asked our association members to submit their questions, concerns that they wanted addressed by experts. And we used an aggregator application called Slido to collect these questions and sort out the most burning queries. Our first question for this evening is for Dr. Prativadi. And this is a question close to my heart. So, Dr. Prativadi, many of us want to take that planned vacation while summer still lasts. What travel advice will you give to people in general and specifically to women wanting to step outside in these times?
Yeah, I think it's best to be cautious right now. I mean, you got to look at the reason why you're traveling. Are you traveling for something, for a situation in which you're absolutely irreplaceable, where it's an absolute, family need and you have to be there? Or is this something that you're traveling for recreation? Because you have to keep in mind that one of the only things that we have in terms of mitigating the risk of coronavirus at this point in time is our behavior. And so traveling, especially because, especially in the United States, testing is not quite up to snuff, right? So it's not like we're getting a test and saying, oh, we're negative. Okay, so we're okay to travel. You may be inadvertently spreading the coronavirus. Also, when you travel, it's one thing if you're traveling by car and you can kind of control your environment and you can wash your hands, before and after you touch surfaces and keep your hands clean and keep yourself away from people whose exposure you don't know. It's another thing if you're stepping onto a plane, because you really can't control all the surfaces that you're getting into contact with. But if you absolutely have to travel, I would say use all the precautions: social distancing, masks, hand sanitizing, frequent hand washing, and also, you guys saw the graph, the algorithm I just showed you. Keeping your stress, lower will actually strengthen your immunity. Eating foods that support your health, being around positive people that also mitigate your immune risks as well. And in terms of vacations, vacation is a frame of mind. So, you can vacation and pretend you're a tourist in your own town where you know the geography. So I would really challenge everyone to, get creative and do things even in your own home that you wouldn't normally do and make it a safe vacation.
Right. Thanks. Thank you, doctor. That kind of answers my question. Thank you.
Thank you, BT, and thank you, Dr. Prativadi. So the next question that we have from the VAGR community comes from Priya Ghosh, and this is for Dr. Sarkar. Dr. Sarkar, you know that with summer, people want to go outside, be on the swimming pool. So the question is, can swimming be recommended in the pandemic? Will the virus affect you in a properly treated pool as well?
Yeah, so it's a really very interesting question. Thank you, Rohan. So, well, answer to this question, I should be either yes or no. First of all, I would tell you that properly treated pool should not spread the virus. And to begin with, there has not been any cases or any reports so far that SARS-CoV-2 virus has been transmitted through any water. So it is not transmitted that way. However, things I would put that way is at first you have to know where you are living at this moment. Which city are you living in? Is this the city where cases are rising daily and daily we are making new records? then it is not very safe to do any sort of outdoor activities where like there is gathering of people happening and you cannot safely maintain your 6 feet distance. So the thing is that, let's say, if you go to a pool, which could be a pool or any sort of recreational water or whatever, whatnot, if you know that if you can, like, you can go, still people wants to go. I mean, it's completely their personal choice, but you have to think, can you do it safely? And in that case, as long as you are outside of the water, you should be compliant with your face mask wherever the surfaces which getting touched by multiple people, let's say handrails or like shower faucets or let's say the any other areas, then you have to be very careful about touching those areas. And if you are touching, then right away try to wash your hands with soap and water, and at least 20 seconds you should wash your hands. And also, I'm not telling you when you are jumping into the water, be with the face mask, that is not safe. So, but still, before going there, you should be wearing it and maintain 6 feet distance wherever you are. If you are inside the water, even you are outside of the water, because we have seen pictures from our all those holidays. Like, we have seen people are gathering in the pool and they are like on top of each other almost, which is not healthy, and it's not like it's not healthy. It's not safe for anybody, not for yourself, not for people to others. And one thing I just would like to say that, all the recreational waters and everything, they have set guidelines. And federally, there has been that federal government bodies, for their, what are the chemical products they should use to clean their pools and disinfect them.
Thank you, Dr. Sharkar. That was very informative.
Thank you.
Thank you. So our next question comes from Shagorika Pushti, and this is for Dr. Das. Dr. Das, can coronavirus spread through tap water in case of contamination or untreated water supply?
Well, so far I would say no. As I have already said, as this is named novel coronavirus because we don't know everything about it. But so far, whatever we know about the fact that there is no transmission through water as of now. So there we should not be worried about that. And so far, there is no concrete evidence.
So doctor, do you advise that it is, we can go anywhere and then have water? Is that advisable, or would you suggest that we are always careful about where our drinking water sources?
That is something important, because the water itself may not be problematic, but when we are using a common area, we are using the same tap. There may be any contamination, because sometimes people use same glasses to have the water. So those are the things we should be careful of, but not from the water itself.
Okay, all right, great. Thank you, doctor.
Yeah.
Thank you, Dr. Das. And staying with water and the summer, the next question comes for Dr. Sarkar again, and this is from Jayati Chaudhary. Dr. Sarkar, it was assumed that warm weather would stop the spread of the virus, which obviously has not happened. And so, looking forward, with fall coming, will it get worse?
So this is another interesting question, I would put that way. So, this is a respiratory virus. So it's spread and everything is among us. How we are doing it, that basically like how our behavior for this week, that is going to be reflected in next couple of weeks. So the thing is that so far it's been predicted that by fall, case will go up. And especially if end of fall and beginning of winter, if it continue to go up, that will be a really challenging for all the healthcare workers and all the healthcare setting, because winter is the earlier part of the winter. October till February, that's the biggest flu season. And each year, in USA, almost 12,000 to 62,000 deaths happen because of flu. So if these two march together, end of fall and the winter as well, it will be a devastating situation. I think the way we are behaving at this moment, like every day we are making new records, this is not going to help us at all. And also at the same time, this is a country that has to be stable economically. Everybody has to run. You cannot just be stuck here, and you cannot be in the homebound, nothing like that. You have to just make plan how you can move forward, do your regular stuff, and be healthy at the same time. So still the same thing, same common thing. You have to be compliant with your mask, and so that you can do everything as well, and you can stay healthy. And it's projected so far the case will go up.
That's very hard to take, doctor, but we'll keep our fingers crossed. Thank you so much for that.
Still, I mean, there is still hope that we can. I mean, there is chance that we can change ourselves a little bit. Like we can be as Dr. Prativadi is saying, we should be creative. What we can do that we're staying home or like staying in our cities the same way. We should figure it out that what we can make us happy and healthy, and we don't pose ourselves and not to other person to risk of any sort of. So there is time for fall that we can control it, but we need to change our behavior a little bit.
Thank you, doctor. Thanks so much.
Thank you, Dr. Sarkar. Our next question for the evening is again for Dr. Das. This comes from one of our community members, Shabnam Alam. The question, doctor, is, do you think the virulence of virus is decreasing as we see less deaths?
Yeah, this is a very important question because when we see the history of the coronavirus, so this is not the first coronavirus epidemic or pandemic we are having. We just had SARS, which is SARS-CoV-1, and before that we had MERS. All of them comes from the same family. So with the history of the previous coronavirus attacks, we can see with time and with mutation, the virus becomes less and less and less virulent. So we are hoping this time also this virus will follow the same trend, that with time, with mutation, this will become less and less virulent. But as I said earlier also during my first part of the interaction, that sometimes we can see some exceptions. While we are having one mutation, then another mutation, it is going down, 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 and suddenly one mutation goes otherwise, and it suddenly gives some spike in the cases. So in most likely, in most cases, we will see the decrease in the number of cases, but sometimes it may happen the one odd mutation which goes otherwise. But overall, we are all hoping that with time and with mutations, things will become much more easier for us. The disease will become less virulent, and we will have much more milder symptoms, and the death rates will also go down with time.
Doctor, would you also say that as a community, as a race, will there be a time when our immunity, we become immune to this particular strain of virus?
Yeah, we are hoping. We are hoping about that also, as we have very much discussed about the herd immunity. But getting the herd immunity itself, the road to herd immunity is very tough because it costs many lives. But ultimately, in the end, we will have some positive effect. The antibodies will be in our blood, and the plasma therapies will give antibodies to many more. So in the end, we will have some effects. And about the genetics you told, that's also a true fact. We are seeing the less cases in the African region so far, in the Africa itself. And in India also, India, though the total number of cases is very high, but when you see the total population itself, so per population, the number is still better than many other countries. So there is a genetic link, and there are other factors like we are having BCG vaccination. So BCG vaccination protects many from this kind of viruses. And also, as countries like India, where there is huge cases of malaria, the anti-malarial drugs that people take for malaria is indirectly helping us against COVID virus. So geography-wise, we will see some variations of this disease.
Thank you, doctor. That was very informative.
Thank you, doctor. Our next question is for Dr. Taposh Chattaraj. Dr. Chattaraj, and this question is very, very close and important for all in the BAGR community and those of us who stay away from our parents, our relatives back in India. Our parents, our folks, our relatives are aging, and they have several medicines which are regular for their ailments, like for diabetes, arthritis, vitamin deficiencies. If they're recovering or if they're actually infected from COVID-19, does their regular medication continue as normal, or do you see any complications while recovering from COVID-19?
Well, thank you for the question, an interesting one. The problem will be faced by each and everyone who is infected with the COVID-19, be it elderly or be it the young or the children. Certainly, the question to be answered accordingly. See, the COVID-19 infections is definitely a new one. Naturally, the newer things are coming out. This COVID-19 induced any changes in our body from the inflammatory aspects or from other aspects. Like, see, it can affect or damage different systems and organs in our body during its infection and during the hospitalization. So, for example, this COVID can damage the renal system, the patient who doesn't have any renal function disturbed. So naturally, he or she can develop the renal dysfunction. This can lead to the adjustment of doses of the drugs or the newer drugs or the change of drugs or stoppage of the drugs the patient is already taking. Another point of view is the hepatic dysfunction, that means liver dysfunction. This is also one of the main factors in which the drug metabolism can change the different actions of those drugs patients is already taking. Okay, so we need to adjust the dose of the drug, change the drug, and the same formulary that we have to follow, like the kidney changes. The different organs also being affected. So naturally, when a patient comes to home from hospital, one has to be very cautious about using the number of medicine he or she will receive following the post COVID-19 infections. So get the suggestions very clear from the hospital or the regulated authorities who will advise you or the patient what medicine he should take. Naturally, it's very, very important. Otherwise, there may be some drug interactions which will reduce or which will increase the toxicity or the side effects of other drugs. So one has to be very cautious and very, very clear about getting the instruction from the hospital authority before being discharged. That is the question. Okay.
Thank you, doctor. I think that's one of the most important questions that each of us need an answer to. Thank you so much.
Okay.
We'll go to our next question, and that is for Dr. Arunava Ray. Dr. Ray, with the high number of deaths post-hospitalization that we are seeing now, and especially in the US, do you think that African Americans and individuals of Hispanic origin take longer to respond to COVID-19 treatment compared to non-Hispanic white individuals?
It's a very relevant question in the United States. People of African American origin have been affected as the most as far as COVID-induced mortality is concerned. They have the highest death rate among all communities in the United States. This is closely followed by the death rate in the Hispanic population and followed by the American Indian population. First is access to care. Access to care is always an issue with the minority population in the United States. African American people, Hispanic people, and American Indians have to work harder to get access to medical care. They have problems reaching the site of care. That's number one. Number two, they already have coexisting illnesses. They have severe obesity. A lot of them have heart disease. A lot of these communities have diabetes more than the general population in the United States. So they have pre-existing conditions which predispose them to get sicker. And with later access to care, the disease is often more profoundly present in the population that we are talking about. In addition, as far as Hispanic population is concerned, especially in the border states, a lot of Hispanic people are undocumented. So they are very scared in accessing medical care early because of the fear of being discovered, so that the immigration authorities would know where they are located. So
that's a great point.
Prevents people from accessing care. Plus, this delays care. A lot of these folk have other illnesses. So the combination of these two factors have led to a very high number of deaths in the minority population. And this is a situation which will take a long time to get addressed.
Thank you, Doctor. Very informative, and from the perspective that we see it, it's very informational for our group as well. Thank you so much, Doctor.
Thank you. Thank you very much.
Thank you. So we covered age, race, and now there is a gender-specific question, and this question is for Dr. Prativadi. So, Doctor, are women more susceptible to the infection during their menstrual cycle, or if they are pregnant? What advice do you have for women going through either cycle, especially during the pandemic?
Yeah, this is a great question. So I'll take those two things separately, the menstrual question and then the pregnancy question. So in terms of the menstrual question, we don't have really good data on that for us to give an evidence-based answer to that. We know that there are fluctuations in a woman's immune status throughout the menstrual cycle due to hormones, and then of course also just due to the fact that during menstruation and even during ovulation, the immune system changes in the vaginal canal, going up through the cervix and going up through the uterus. And so if you understand women's anatomy, the reason why this becomes relevant is because basically women have an open tube into their peritoneal cavity. So the fluctuations in the menstrual cycle could have an impact. We don't have specific data to that reflects that. The other problem with this is also generally in medical research, we do not ask women where they are in their menstrual cycle at the point in which data is being obtained. And so this is kind of like one of my big soapboxes about like women's health and generalized research is that we need to incorporate those questions. So I really appreciate that that question. So the other thing is pregnancy. So we know that pregnancy is somewhat of a transplant kind of immunology, right? We actually call it. It's like like a host graft immunology, transplant immunology, because the woman is hosting this a fetus or more than one fetus and placental tissue that very intimately interfaces with her cardiovascular system, her immune system, her neurologic system, her endocrine system, and its DNA is like half not hers. Right. So pregnancy is somewhat of an immunosuppressed state. The interesting thing with the data is what it's showing is that so pregnant women are may have some susceptibility to the COVID-19 virus that's greater than non-pregnant women. And specifically, the data indicate an increased risk of ICU admissions if they were to get it, ICU admissions and mechanical ventilation. So it's like 1 in 68 of pregnant women versus 1 in 110 of non-pregnant women with the ICU admissions. And then in terms of mechanical ventilation, it's 1 in 195 of pregnant women versus 1 in 370 of non-pregnant women. And interestingly, the mortality rate is not different. Even if the women go through mechanical ventilation and those invasive procedures, the mortality in the current data has been shown to not be different. Obviously, we're collecting more and more data all the time, and we're going to have to sift through that and actually, get to the, the truth of the matter. What I tell people what I tell pregnant, patients is that you want to reduce the challenges that you're exposing your body to. As it is in pregnancy, you're going through incredible physiologic changes. Your blood volume nearly doubles in the late second, and third trimester. The immune system completely changes. The cardiovascular load is different. Your brain is changing. Your breasts are changing. Everything is changing. And so just reduce your exposure to all these other extra stressors that your body also needs to account for. And also, don't worry so much. Just do what you can, because the stress also, you want to keep that down. You guys just saw the whole graph, right? If you increase the stress, that's going to increase the stress chemistry, the inflammation, and then it's kind of like, so we just want, to keep the whole system, just as calm down as possible.
Thank you, doctor. That was really good. Thank you so much.
I appreciate these questions. Great questions.
Thanks. Our next question again is for Dr. Chotturaj. Dr. Chotturaj, as a consulting physician during the pandemic, what is your worst COVID-19 related fear when responding to a non-COVID-19 urgent case?
You mean the fear about the non-COVID patients, I think?
Yes.
Okay, certainly. Yes, the hospitals are now flooded with the patients, mainly with the COVID-19. Of course, vis-a-vis and parallelly, those are non-COVID-19 patients who become serious to be admitted in the hospital. Now a matter of concern. Patient do not get the bed to get to admitted in the hospitals. Naturally, our concern from the physician aspect that for the non-COVID patients, one must be very serious about managing those cases. They must get also equal priority in managing the cases. Certainly, I do fear from my aspect as a doctor, not as a doctor only, being human. Certainly, they are to be considered equally. Most of these patients are in serious conditions. To me, the first thing is feeling of oneness that comes globally. As a physician, as human, one should come forward that both the patients, both category of patients must be considered as serious. They should be taken. Yes, the fear about the patients and fear from the doctor's aspect that those COVID patients already admitted in the hospitals, for those non-COVID patients, they may get infected with the COVID. That is another area of concern. So doctor and health personnel should be very cautious about tackling and dealing with the disease. Certainly, it may get worse if any non-COVID patients do get infections from the COVID patients. So there must be some protocol in the hospital. Those patients are having the non-COVID history, they must be treated in separate way. And those having the COVID must be treated in another way. So in hospitals, we usually admit the patients as an isolation ward where the suspected COVID patients are being admitted. They do not have the established COVID infections. They need some time to get the results from their investigations. But those non-COVID patients, they are to be equally admitted. We must be very serious. We must feel one from them, or their relatives, from the patients, from other as health personnel. We must give proper care so that they must not be neglected. That is.
Thank you, Dr. Chotturaj. That was very informational for all of us. So the next question and the last question for the evening is for Dr. Arunava Ray. Dr. Ray, this question is in two parts. The question comes from our BAGR Association group, Lili Mitro. From a perspective of a mask, is the mask effective, or would you recommend other PPE for public? That's the first part of the question. The second part of the question is, and what fascinates all of us here, all of us here, that as a looking at all so many fatalities growing every day with COVID-19 complications, how do you guys keep yourselves motivated? I mean, I come in from work one day and I'm like, I'm exhausted, I can't do anything. how do you guys keep yourselves motivated for the very next patient?
Okay. Wonderful questions, both of them. The first part, let me answer it this way. Let's look at it. This is a respiratory virus. It is dissolved in our respiratory secretions. It comes out of your nose or your mouth. If you wear a mask, one, if it's a medical mask, medical grade, or if it's a thick piece of cloth, this will prevent it from spewing out all over. One, you can see a lot of YouTube videos and you can see popular social media which have shown with special ultraviolet photography that using a physical barrier on the face will prevent it from spreading longer distances. And especially when physicians wear the medical grade mask, which is the N95, the chances of you getting your respiratory bugs out into the open go down a lot. As far as imbibing the infection from other people, definitely wearing a mask will protect you from getting infected. Unless somebody comes to your face and talks in front of you, the chances of getting infected are of course there, and you cannot prevent that from happening. So as far as physicians go, we wear the N95 mask, especially when we do highly dangerous procedures which can be life-threatening to the life of the medical person. The patient is being attended to. At that time, we generally don't think of ourselves at all. But during this pandemic situation, we have also got to think about ourselves. Generally, you can talk to any physician, we generally don't think of ourselves when we are doing procedures. So essentially using this as a physical barrier to prevent easy infection from the patient, doing respiratory procedures on patients, this definitely helps. That's number one of the question. I hope I have answered a part of that question.
Yep.
And the second part of the question, that is, I will give you my personal experience. I was on call. I'm in a town where the death rate is pretty low. It's a decent sized town. The death rate is low. You see, as a private practicing physician, I will probably see about 4 or 5 deaths in the whole year. The first weekend I was on call, I had 5 deaths in one day, all related to COVID. So as a physician, we are humans first and physicians second. It completely shocks your being. So it takes a few days to absorb that. And they were all my patients who died of COVID. So we are trying to learn this disease like everybody else. We tried to treat this disease using our previous experience with acute respiratory failure and other pulmonary infections. It didn't respond to any of the treatments that were given to it. And then, not learning through our mistakes, there are more and more trials coming out with newer medicines which are beneficial to the patients. So when remdesivir came in, definitely it gave us more weapons to fight this virus. And we started feeling a little bit better. And in the United States, the Food and Drug Administration definitely has a more controlled authority in the way we practice medicine. We cannot use certain medicines. And as a cardiologist, using hydroxychloroquine, which we had heard is really good for you. And then subsequently, that article from Lancet and New England Journal were retracted by the publishing physicians. We got a little concerned. And both these medicines, which were used initially, the erythromycin group, as well as hydroxychloroquine, have profound dangerous effects on the heart. So as a cardiologist, we were called in to take care of the EKG changes, which can be immediately life-threatening. So that is why, like in the United States especially, things are a little more controlled. We can't try new drugs. We can, but these are established drugs which can be tried. But newer therapies have to be used with lots of care just to avoid being investigated by the authorities. So we are a little bit limited in doing a lot of things which can be done in other countries. So essentially, the first response was a lot of scare, and then subsequently we took it up as a challenge, and now the mortality with dexamethasone, remdesivir, and other anti-inflammatory drugs are being used appropriately now. So we have a little more confidence in treating patients at this time. Thank you.
Thank you, Dr. Ray. Very informative, and for us, very what we see from you and all of the panelists here is really amazing work. Appreciate all the work that you guys do. Thank you all the panelists for the questions. We will kind of open up the panel for one question that has come in from our various sources. So
it's from Indranil. Neil,
yep.
Where are you, Mister? My husband.
Go ahead and ask your question. Who is it for?
Indranil?
I guess anyone in the panel can answer this, but my question is generic because it is happening both in the US and in India. Number of new cases and number of new deaths are increasing at an exponential rate, basically in both countries, especially India. And this is due to the current social distancing, physical distancing and masking practices, which some people are not following, as was mentioned previously. So my question is, what do you expect, since there is a finite population everywhere, what do you expect to be the final scenario due to this absence of control in controlling the spread of the virus?
Can we just choose one doctor, if that's okay? Can I choose Dr. Ray? Dr. Ray.
Okay, Indranil, that's a wonderful question. How is this going to come to an end? Fortunately, what has happened, the infection in most people who do not have pre-existing diseases is pretty mild. So this actually helps in turning them into the antibody positive state, which a lot of people have asymptomatic infection. A lot of healthy people, they don't have severe disease. And this is more prevalent in India. Here people are getting, in the United States, people are getting a whole lot sicker than in India. If you hear, I've talked to relatives over there, they get infections, but they're asymptomatic and they spread it around. Unless they have elderly people in their family who have coexisting conditions, then the outcome is usually bad. But what will happen is more and more people will get infected. Unfortunately, a lot of people who have coexisting conditions will get really sick and the outcome may not be very good. But with this spread of immunity, hopefully will come a stage where the vaccine will be available easily and vaccinations will start. And somewhere along the way, we will build up herd immunity, which may be able to contain this whole problem at a certain point.
Thank you very much.
Okay. Great job, everybody. It's been such a pleasure to have you all. I just want to at this point, I just want to thank the people who have been responsible before we move on to our final guest, Dr. Biswas. So the people who have worked so hard, Tufan Maiti and Dipendra Pushti for technology, thank you. Rohan Kaur and BC Kormakor for being such excellent moderators. Joyati Chaudhary, thank you for your efficient communication skills. For support, we have Shaguri Kapushti, Priya Ghosh, Shabnam Alam Biswas, Lily Mitro, and Nonita Maiti. And of course, I would like to thank my husband, Indranil Burman, without whom this would not be possible. Thanks, Indranil. You rock, mister. Okay, now for our final guest, the cream of the crop, right? Dr. Amit Ranjan Biswas, who joins us from London, UK. He is a child and adolescent neuropsychiatrist. He's an ex-honorable senior lecturer at Queen Mary University of London. He's a multi-award winning filmmaker, poet, playwright, thought leader, and a global inspirational speaker and leadership trainer. His awards include the London Mayor's Award for Leadership, Laker Fund Award for Scientific and Medical Network. He has recently been nominated for Carissa Evans Award for Creativity and Innovation in Mental Health from West Midlands Authority, UK. He is well known for his debut feature film Bridge, WWW Working with Worries, which he produced in 2001. He has directed Maya, which is a musical, which was premiered at Bloomsbury Theatre in 2003. He's also well known for his play Homa Pakhi, which has run for several years in India, that has raised consciousness in public on mental health issues. Amit has also served as board members in several international organizations and charities. His mission is to empower and guide individuals and organizations. We are so honored to have you here, Dr. Biswas. Please talk about your work, heal us in this pandemic, and bring us together.
Thank you, Madhumita. The honor is all mine, and I'm highly privileged to be here today with a galaxy of wonderful speakers. It's really great to hear you and connect deeply with all of the things scientific, spiritual, and especially with Pratibha, with the holistic understanding of illness. Now, before I come to my topic, perhaps to tune in everybody together, I do a very little prayer from Vedic chanting from very ancient times to bring us tune up into this healing process together. Om Asato Ma Sadgamaya Tamaso Ma Jyoti Gamaya Brittoram Britangamaya Avirabhidmayadhi Om Shanti Shanti Shanti. Take me from ignorance and untruth to truth. Take me from darkness to light. Take me from death to eternity. O divine Brahma, God, Lord, reveal yourself to me. It has been long that I stopped myself almost recognizing or calling myself as a doctor, but as a healer. I'm sure a lot of you probably will think that, because healing or recovery is a very holistic process. We have physiological, emotional, social, and spiritual aspects of healing where we come together as a person, as a whole person. And if you look into the whole of our COVID times, the most important impact is not just people dying and being sick, is that emotional and spiritual crisis and social crisis that's happening all over the world. And we needed healing. We needed to connect, reconnect. And perhaps COVID, the virus, suddenly comes from nowhere and teaches us something, gives us some lessons, gives us something to recalibrate, rethink, and create a shift in our consciousness. You know, these pandemics and disaster and kind of devastations are not new in human history. We have had this before. If we just a few hundred years back, we have plague. We didn't even know what plague was at the time, what is causing it. It's devastated Europe. 1/3 of the Europe population died completely. In the year of, I wanted to bring up a little story here. This year of 1348 and the time of Florence is a kind of a early Florentine Renaissance. We have people dying on the streets, parents deserting their children, is just unbelievable chaos and calamity. A young person called Boccaccio, a writer, understood that he cannot be in that space. The city is becoming toxic. What he did, he just, in our terms, socially distanced himself and went to Tuscany, a little kind of dilapidated villa in Tuscany with 10 of his friends. And they talked together. They came together as a community. What they did, these 10 people just talked, had laughed, shared their stories, songs, and their silences. They danced, joked, had a laugh, and they survived. This is about our community spirit, bringing us together, because together we are powerful. We are actually not socially distancing. I am kind of very curious about the word. We are physically distancing, of course, for evidence-based reasons and for the virus and kind of preventing the spread. But if you think, when we are locked down, we are connecting more with our family members. We are eating together. Companionship comes from the word com and panos, people who eat together. Some people in the families eat in front of the television and not together. Now we are talking. We are bringing back a real community integration. And if you see in the happiness researcher, the one most important variable that makes us happy is the deep social interrelationships. The happiest countries in the world, such as Denmark, Costa Rica, South American countries, at spaces like Okinawa in Japan, why they're happy? We are socially connected. We talk. Here or even in India, in these times, we are socially becoming disconnected. We don't talk to our neighbors. We don't know. And this is the time, a little shift our consciousness, the what is important in our life. What makes our life so fulfilling, so radically happy. And the healing comes from that connection. I do not just see a pandemic going on. I also see a kindness pandemic going on. We have our hearts been open, almost broken up by this virus. We are allowing our kindness to flow. And another thing that makes us happy is giving. A lot of research of benevolence. We are looking after our animals, our stray dogs in Calcutta. We are actually going beyond our means to help our neighbors carrying food. And we are coming together more and more as a family. Perhaps I will give you another little story. A story about a fear monster or a scarcity monster. Now, in a kingdom, king was away, and there was a big, ugly, scare monster that comes in, who is foul-mouthed and really looks bad and really kind of coming into the whole royal palace, and everybody's very scared. And then they're kind of shouting at the, go away, just kind of, you foul-smelling hamster, wow, I can't tolerate you. The more they send abuse and insult, the monster grew a little bit more, a little bit more, a little bit more. More they try to drive this away, this person slowly goes into the royal palace and sat even on the throne and grow bigger and bigger and bigger. Now king comes back after a while, and king sees the monster and says, oh, hello, welcome, my visitor, I see you on the throne. What do you like to drink, Darjeeling or Earl Grey? And the monster suddenly grew a little smaller. Then, according to what the people saw around the king, also start welcoming the monster. And the fear, anger monster grew smaller and smaller and smaller and suddenly vanished. What we learn from the story, that the monster of fear and pain will be always there. It's not the first time we are having these difficulties in our lives. Pain is inevitable. We will suffer. Our people, our near people will die. People will get sick. We will have disappointment simply from our examinations to our jobs, to losses and everything. But we have a choice not to suffer. We have a choice, a very clear choice not to suffer. How? By embracing this fear and anxieties and trials and tribulations, embracing pain and overcoming suffering. So what are you doing? You are changing the relationship of pain or situations not in our control. Zone 2. Like weather, like wife, like my boss, like COVID, like rain, like whatever. We try to control this thing. We try to control our exams, try to control our work, try to control this, and we lose control. Rather being in zone 2 and trying to control this, we can be in zone 1. And what is zone 1, according to Stoic philosophers, is about our thoughts and attitude towards things. We can relate to things differently. We relate to our pain, emotional or physical, differently. And changing that relationship with our pain, which is a practice, it's not easy, change our lives, heals us. If you see one of the kind of greatest, what should I say, is a medical person, molecular biologist from MIT, John Kabat-Zinn, 40 years back, brought mindfulness from Buddhist philosophies, where it's more systematized. Obviously, mindfulness is in kind of, the principles have been shown into all kind of philosophies, like in Christianity, mindfulness. In Matthew's gospel, they talk about eat the bread of today, tomorrow will take care of itself. In our kind of Patanjali's Yoga Sutras, they say Tatha Yoganusasanam, the first sutra. The teaching of the yoga is in the now. John Kabat-Zinn brought these conception of mindfulness from particular Eastern philosophies to work with people with chronic pain in hospitals in US. What he saw, there are chronic pain, there are patients with chronic pain. There is a huge psychological component to it and how they relate to their pain. So he practiced this mindful meditation, 6 weeks MBSR course or 8 weeks, to tune into their pain, to lean in more to their pain, embrace their pain, and being fully present with this pain, and they start evaporating their pain, so they start not suffering. Mindfulness is about paying attention in the present moment or the moment by moment experience without judgment. The simple practices of mindfulness can bring healing, because what this COVID has done, either we are going in the past, oh my God, this person has died, what's going to happen? This is so much of a news coming up from everywhere yesterday's, and I need to have information, this research, and so much of gathering, and that makes me really think and overthink and ruminate. Or I throw myself in future, what's going to happen? Oh my God, I might not have food. My mom, who is 6,000 miles away in India, is going to die. Oh my God, if I get out, I get infected. Oh my God, if I drink this water, if I swim, this is going to happen. Oh my God. So I'm in the past or in the future and not in the present moment. And this is a practice, a lifelong practice, how to be fully present. When we are fully present, if we drink a coffee and enjoying the coffee, we smell the sight, how you actually kind of feeling the temperature and the warmth. Because we don't, we think. We are watching television and eating. We are going and driving somewhere and we do not even see where we are going, because we are thinking all the time. We are frantic, either in the back or in the past. We don't hear. We enjoy our life and not being with the experience itself. So what happened? Our brain becomes fast and brain becomes frantic. Just think about this. In every home I see, my friends and family, people are really bored at times, but they find new ways of doing things. Somebody started pottery. Somebody haven't actually done painting for a long time. Somebody's singing Tagore songs. Somebody is chanting, dancing, flourishing way of self-expression. And we need to remember creativity is not an aptitude, it's an attitude. It's an attitude of openness. It's an attitude of curiosity, spontaneity. If you look at the little children, they go and look at a little kind of flower, a little ant or a bee, and they're excited and curious, and they're in the moment, they're present. They're fully with that flower, one with that flower. They are naturally mindful, and that's their happy. They're radically alive and excited and in flow in that moment. And that heals. When we are creative, when we open our heart and open with everything with surprise and curiosity, that's healing. Because fear and scarcity closes our heart. Creativity opens our heart. And very similarly, think about this. At this time of difficulties, I wake up in the morning every day, open my eyes, and I am alive. I have diabetes myself. I am Asian. I go to work. I work with children with neurodevelopmental and forensic difficulties in serious, severe kids, and I'm a key worker. And I have to go crossing tubes and buses and stuff, and it's a long distance. Yes, I am afraid of dying. I am afraid of being ill. But at the same time, every morning, I'm grateful. I open my fridge, I have food. I have a roof. So many migrant workers in India walking hundreds of miles and dying on the streets and railway tracks. I'm deeply grateful to be alive. And this gratitude is it's not just thank you notes. Bringing the radical attitude of gratitude, that grace in our life is healing. When we are grateful, we are happy. It's not that we are happy and grateful. The gratitude researchers will say to you, if you simply practice 3 things I am grateful for today and write a gratitude diary for 21 days, it changes your brain. Bringing that attitude of gratitude. Also, you cannot be grateful with a closed heart. You have to open your heart, know that good is happening. A day is given to you. You haven't done anything to do and deserve this day. It's given to you. It's a gift. A sunshine, a little flower, disconnections is a gift. The only reciprocation to this gift is saying, thank you for this day. I'm deeply grateful. And you cannot be grateful in the past. You cannot be grateful in future. If you are grateful now. And that gratitude brings you powerfully in the present moment, being mindful. We need to stop. Stop means what? Stopping is purposeful pause, S-T-O-P. And we learn to stop and pause in these times. S for stopping in every few moments. T for taking a deep breath. O for observing what's happening outside and in. And P is proceed with a smile and kindness. And you can do that every moment. Having a shave and stop. Going to a shower and stop and feel the water trickling. Having a coffee, stop. Before jumping into answering a phone, stop. Take a breath, observe and proceed. You are bringing yourself in mindful present moment by moment. You do not have to go to Himalayas to meditate. Paying intention to meditate or be mindful, paying attention and returning to attention and having that friendly attitude towards your practice. You are flexing your spiritual muscles. You are changing your brain. You are changing your life. You are healing yourself with that solid, cultivating presence and leadership excellence, where you send these vibes around you and uplift people, heal. Somebody asked the questions of motivation. We don't need motivation. Motivation is within you. We need to just reconnect with ourselves. We motivate ourselves. Nobody can. When we are open, we are kinship. When we are grateful, we are mindful, we are positive. We do not need to be positive. You are positive, you need to be still. More you are still, when you are connected, more you are aware, you are more compassionate. And last but not the least, again, what this time teaches us to come together in a very hopeful way. Hope. Hope has two dimensions. I can't give you a false hope. Somebody asked, Indranil asked that, what is going to happen? I'm not going in future. I am hoping the future is bright, but that's in future. But I want to be, hope is another dimension, to be present with faith. Faith is not a religious term. Faith has been a courageous trust to life, a courageous trust to life. And that's the dimension of now. I am hoping now for future. I'm hoping in this present moment to be bright and optimistic in every possible way, that we will survive, we will live to learn differently, we connect with nature in very differently, because we actually created a very consumer relationship with nature. And we need to shift that relationship, because nature is sacred. You go to Indian Americans, in they will say Pachamama. They will say that sacred relationships with this art, the mother art, the Gaia, which we lost. And we have to reconnect and recalibrate ourselves to heal the art and heal ourselves and each other. I will finish again with a healing prayer. Comes from very ancient Vedas, for the healing of the earth and ourselves in loving kindness. Inviting the bell of mindfulness again. Om Madhubata Ritayate Madhu Sharanti Shindhabaha Madhirna Santosadhi Madhu Nakto Muto Sasi Madhu Mat Parthivang Raja Madhu Daurastanapita. Pilgrims of truth, may the air be pleasant for us. May the rivers flow with sweetest nectars. May the herbs be sweet. May the day and night be peaceful. May the world be at peace. May the heavens bring us peace. Madhuman Vanaspatir Madhumarganasta Surya Madhigarva Bhavantuna. Madhu. 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 Thank you. Thank you, everyone. Thank you for listening. May you be well. May you be happy. May you lead your life with ease and kindness. Thank you.
Wow. So I'm still in a trance. Do you guys feel that? Like you just took us to a different world and just made us realize that we have to live in the moment. We have to be grateful today for all that we have. And it really made me think. Did any of you feel that? Any comments? Shraddha, you're nodding your head. What did you feel?
Well, I think so. So I practice transcendental meditation every day. So I practice twice a day with about 2,000 to 3,000 other meditators, and the feeling I got with that Omitji is kind of like getting down to that level of where it's you're just like one with the field, and you've just, transcended the disturbances and all of that, and and I feel it right here. So, and it just kind of like you settle into this space, and it's just like there's no disturbance, and it just is. So it's beautiful.
Thank you.
Anybody else would like to say something before we sign out?
So Madhumita, I would like to thank Dr. Omid, because I have only very recently started yoga and meditation, and I can feel myself relax. So this was really the chant especially was very relaxing. It kind of made me think about myself. Also, everything that he was speaking, I can actually relate to it. So thank you so much, Dr. Omid.
Thank you. But can I make a comment?
Sure.
Yes, sorry, I shouldn't speak after my speaking, but just wanted to make. Yes, I'm really glad that yoga is kind of worldwide phenomenon now, and I'm glad that you are meditating, and all path is valid, all meditations from loving kindness to transcendental meditations to mindfulness to japa and everything. The one thing to remember perhaps that it is a transformative experiences as tool. They are not relaxation exercises. You feel relaxation as a side effect, and it's a process. I mean, like yoga is, and in Ashtanga yoga, there are 8 slow processes, and various other yogas. But at the same time, that yes, and it is, as I mentioned, I haven't mentioned, it is not a religious tool, or we use as a tool of relaxation exercise. Relaxation is beautiful and calmness, but as it just been said, it is what it is right here, in sense of greater awareness that develops these practices, being the right actor and arriving at a space where our internal order is created, an order that inside that we kind of aligned with the cosmic order. So it is a very spiritual exercise, and I hope, coming from our background, we teach this method is not yoga and meditation are not tools and not relaxation exercises, but spiritual methods of systematized practices. Thank you.
Sure.
So very beautiful. I think on this very note, we would like to sign out from Rochester. I would once again like to thank a fantastic panel, our distinguished doctors and scientists who took their time and answered our questions. And I would like to thank my team, because without them, this would not have happened. You guys are awesome, fabulous. And I would like to sign off from Rochester, from BAGR. And we hope to see you again. All the best. Amit, thank you so much. I have no words to thank you. I mean,
No, you are most welcome. Thank you. Thank you.
Hello and welcome to this COVID-19 Global Hall Town Hall session from Rochester, USA. I'm Modamita